I think one of the things to keep in mind is a lot of these patients tend to be a little bit older. And so we have to kind of know how to manage these regimens. If we're thinking about how do we properly manage a triplet regimen and know how to manage some of the expected toxicities from them. Um, I talked about the duration of therapy of each of these drugs. And so for the first cycle, we're giving the HMA therapy for 5 days, we're giving the venetoclax for 14 days, and the IDH inhibitor continuously. But it's important to realize that we don't want to do that duration of therapy for every single subsequent cycle once they're in remission, because that can lead to cumulative toxicity. And so, kind of learning how we shorten the regimens kind of further on once they're in remission based on their cytopenias, their counts, their tolerability. I think that's something important as we look at these regimens going forward, especially with such promising outcomes. And so, our typical patient on these regimens by cycle 5 or 6, they're receiving 3 days of the oral decitabine and 7 days of venetoclax. And then the IDH inhibitors, again, they don't tend to have a lot of myelosuppressive toxicity. And so, usually patients can stay on them continuously. And so I think that's something really important for people to consider with these regimens, that we're able to deliver them in a safe and effective way for patients and still get that really wonderful, remission rate for patients.